Understanding leukemia, different types and treatment approaches on HealthSphere. Welcome back to HealthSphere. Today we're focusing on leukemia, a type of cancer that affects the blood and bone marrow. Understanding the different forms leukemia can take and the approaches used to treat them is vital for patients, families, and anyone seeking to comprehend this complex disease. Leukemia starts in the bone marrow, the spongy tissue inside bones where blood cells are made. Normally, the bone marrow produces a regulated supply of white blood cells, red blood cells, and platelets. In leukemia, this process is disrupted, leading to the overproduction of abnormal white blood cells. These abnormal cells don't function properly and can crowd out healthy blood cells, impairing the body's ability to fight infection, carry oxygen, and control bleeding. Leukemia is broadly classified into four main types based on two key factors: how quickly the disease progresses and the type of white blood cell affected. Acute versus chronic leukemia. The speed of progression, the distinction between acute and chronic leukemia, is crucial, as it significantly impacts the symptoms and treatment approach. Acute leukemia. This type is characterized by the rapid growth of very immature abnormal blood cells called blasts. These blasts multiply quickly and accumulate in the bone marrow and blood, leading to a rapid onset of symptoms. Acute leukemia requires prompt, aggressive treatment to prevent rapid progression and potentially life-threatening complications. It is more common in children, teens, and young adults, but can occur at any age. Chronic leukemia. In contrast, chronic leukemia involves the production of more mature, but still abnormal blood cells. These cells build up more slowly, and the disease typically progresses gradually over months or even years. Symptoms may be mild or absent in the early stages, and the disease is sometimes discovered incidentally during routine blood tests. Chronic leukemia is more common in older adults. While it progresses slowly, it can still be challenging to treat and may require long-term management. Myeloid versus lymphoid leukemia, the cell lineage. Leukemia is also classified by the type of blood cell that becomes cancerous. Lymphoid leukemia. This type originates in lymphoid cells, which are a type of white blood cell crucial for the immune system. Myeloid leukemia. This type originates in myeloid cells, which develop into various types of blood cells, including granulocytes, monocytes, red blood cells, and platelets. Combining these classifications gives us the four major types of leukemia. Acute lymphoblastic leukemia. This is the most common type of leukemia in young children, but it can also affect adults. It involves the rapid growth of abnormal lymphoblasts. Acute myeloid leukemia. This is the most common type of acute leukemia in adults, though it can also affect children. It involves the rapid growth of abnormal myeloblasts. Chronic lymphocytic leukemia. This is the most common type of chronic leukemia in adults, usually affecting older individuals. It involves the slow buildup of abnormal lymphocytes. Chronic myeloid leukemia. This type of leukemia usually affects adults and is characterized by the slow, uncontrolled growth of myeloid cells. A hallmark of CML is the presence of a specific genetic abnormality called the Philadelphia chromosome. There are also less common types of leukemia, such as chronic myelomonocytic leukemia and hairy cell leukemia. Treatment approaches, tailored to the type and stage. The treatment for leukemia is highly individualized and depends on the specific type of leukemia, its subtype, the patient's age and overall health, and whether the leukemia has spread. Treatment goals vary from achieving a complete cure to managing the disease and controlling symptoms for many years. Treatment for acute leukemia. Rapid and intensive. Acute leukemia requires prompt and intensive treatment due to its rapid progression. The primary goal is to achieve remission, meaning the leukemia cells are no longer detectable in the blood and bone marrow, and healthy blood cell production returns to normal. Treatment for acute leukemia typically occurs in phases. Induction therapy. This is the initial, intensive phase, aimed at killing as many leukemia cells as possible to bring about remission. Chemotherapy. High doses of chemotherapy drugs are the mainstay of induction therapy for most acute leukemias. These drugs target rapidly dividing cells, including cancer cells. However, they also affect healthy, rapidly dividing cells, leading to side effects like hair loss, nausea, increased risk of infection, and fatigue. Targeted therapy. For certain subtypes of acute leukemia that have specific genetic mutations or abnormalities, targeted therapy drugs may be used in combination with chemotherapy. These drugs are designed to attack specific molecules in cancer cells, potentially causing less harm to healthy cells. Intrathecal chemotherapy. If there is a risk of leukemia spreading to the brain and spinal cord, chemotherapy drugs may be injected directly into the fluids surrounding the brain and spinal cord to prevent or treat this spread. Consolidation therapy. Once remission is achieved, consolidation therapy is given to kill any remaining leukemia cells that were not eradicated during induction. This reduces the risk of the leukemia returning. Consolidation may involve more cycles of chemotherapy, sometimes with different drugs, or may involve a stem cell transplant. Maintenance therapy. For some types of acute leukemia, particularly all a longer phase of lower dose chemotherapy or targeted therapy be given after consolidation to further reduce the risk of relapse. Stem cell transplant in acute leukemia. For many patients with acute leukemia, especially those with higher risk subtypes or those whose leukemia returns after initial treatment, a stem cell transplant is a crucial treatment option. Allogeneic stem cell transplant. This is the most common type of transplant for acute leukemia. It involves replacing the patient's diseased bone marrow with healthy blood-forming stem cells from a donor. Before the transplant, the patient receives high-dose chemotherapy to destroy their existing bone marrow and leukemia cells. The donor stem cells are then infused and travel to the bone marrow where they begin producing new, healthy blood cells. An important benefit of allogeneic transplant is the graft versus leukemia effect, where the donor's new immune cells recognize and attack any remaining leukemia cells. This procedure carries significant risks, including infection and graft versus host disease. Treatment for chronic leukemia, often more varied. The treatment approaches for chronic leukemia are often less intensive initially than for acute leukemia, and they vary significantly between CLL and CML. Treatment for chronic lymphocytic leukemia. Since CLL often progresses slowly and may not cause symptoms in its early stages, many patients are initially managed with watchful waiting. Watchful waiting. For patients with early-stage asymptomatic CLL, immediate treatment may not be necessary. Instead, the doctor will closely monitor the patient's condition with regular checkups and blood tests. Treatment is typically started only when the disease shows signs of progression or starts causing symptoms. Targeted therapy. Significant advancements have been made in CLL treatment with the development of targeted therapies. Drugs like Bruton's tyrosine kinase inhibitors and BCL-2 inhibitors have revolutionized CLL management, often providing effective control of the disease with oral medications. These therapies are often preferred over chemotherapy for many patients, especially those with high-risk genetic features. Immunotherapy. Monoclonal antibodies that target specific proteins on KL cells can be used alone or in combination with chemotherapy or targeted therapy to help the immune system identify and destroy cancer cells. Chemotherapy. While targeted therapies are increasingly used, chemotherapy drugs are still an option for CLL treatment, often in combination with immunotherapy. Radiation therapy may be used in specific cases to shrink enlarged lymph nodes or an enlarged spleen that are causing symptoms. Stem cell transplant. Allogeneic stem cell transplant may be considered for a small number of younger, fitter patients with higher risk CLL or those whose disease does not respond to other treatments. Due to the significant risks associated with the procedure, treatment for chronic myeloid leukemia, focused on targeted therapy CML treatment has been dramatically transformed by the development of targeted therapies that specifically inhibit the protein produced by the Philadelphia chromosome. Targeted therapy. Drugs called tyrosine kinase inhibitors, such as imatinib, dasatinib, nilotinib, and asciminib, are the standard first-line treatment. For almost all patients with CML, these oral medications effectively block the abnormal protein driving the growth of CML cells. TKIs are highly effective in controlling the disease and have allowed most patients with CML to live near normal lifespans. Treatment with TKIs is often continued indefinitely, although in some cases under strict monitoring and specific criteria, some patients may be able to attempt stopping treatment. Stem cell transplant. Before the era of TKAs, allogeneic stem cell transplant was the main potentially curative treatment for CML, while still an option. It is now typically reserved for patients whose disease does not respond to TKAs or who develop more advanced phases of CML. Due to the effectiveness of TKAs and the risks of transplant, chemotherapy. Less intensive chemotherapy may be used in certain situations, particularly for patients in the blastic phase or those who cannot tolerate TKAs, but TKAs remain the primary treatment. Other treatment modalities and supportive care, beyond these main approaches. Other treatments and supportive care are crucial in leukemia management. Supportive care. This is a vital part of leukemia treatment, focusing on managing side effects, preventing and treating infections, and providing blood transfusions. Clinical trials. Participation in clinical trials offers access to new and promising treatments and contributes to advancing leukemia research. Living with leukemia. A leukemia diagnosis and its treatment can be physically and emotionally challenging. Support from healthcare teams, family, friends, and patient advocacy groups is essential. Many people with leukemia, especially chronic types managed with effective therapies, can live active and fulfilling lives. Conclusion. Leukemia is a diverse group of cancers, each with its own characteristics and treatment needs. Understanding the difference between acute and chronic forms and the specific types like ALL, AML, CLL, and CML is the first step in navigating this journey. The treatment landscape for leukemia is constantly evolving, with significant advancements in targeted therapies, immunotherapy, and stem cell transplantation offering new hope and improved outcomes. Whether through intensive chemotherapy for acute leukemia or long-term targeted therapy for chronic forms, the goal is to control the disease and allow patients to live the best possible lives. Thank you for joining us on HealthSphere. Stay informed, support research, and consult with healthcare professionals for personalized care. This video provides general information and is not a substitute for professional medical advice. Always consult with your doctor for diagnosis, treatment, and personalized recommendations regarding your health situation.